Hello, everyone. Welcome to COEX Talk. My name is Maria, and we have Ana Karen, we have Claudia and Alexandra, and we want to introduce to you guys to Sydney Garcia, who is a very special friend of mine and also my coworker at National Park Service. And she's going to give us a really important conversation about environmental health. So, Sydney, welcome to COEX Talk, and tell us a little bit more about who you are, what you studied, and the reasons why you studied and why you think this topic is important.
Yeah, thanks for having me, guys. Like Maria said, I'm Sydney Garcia, and I work with Maria at the National Park Service. I kind of started my journey in environmental science and environmental health sort of when I got to college. So I went to college at St. Edward's University in Austin, Texas, and I majored in environmental science and policy. And I kind of got a specialization in biology there. And at the time, I was super interested in recreation and ecosystems and nature and getting more people out in nature and enjoying green spaces. So after St. Edward's, I got my master's in environmental management at Duke's Nicholas School of the Environment. And there I specialized in environmental conservation. And I had my master's project there focusing on the ecosystem services of green infrastructure in Austin, Texas. So that was kind of a project focusing on like what does green things do for us? You know, like what does it provide us in terms of water quality, air quality, mental health, physical health, and all of that stuff. And that really has pursued me into the jobs that I have now, like with Maria, doing community planning for the National Park Service, the Rivers, Trails, and Conservation Assistance Program. And it has kind of migrated into what my passion is getting green spaces and outdoor recreation spaces for communities that don't necessarily have that luxury, and all of the benefits that stuff provides. So like I said, like the air quality, the mental health, the physical health, of all of those things that green spaces provide is basically in the work that me and Maria do with the National Park Service, is providing those recreational spaces for people to do that. And it's really important that kind of how we're getting more into with the National Park Service is doing those underrepresented communities. Mm-hmm. A lot of that is the Latinx communities, as well as a lot of Native American and Black communities that we're focusing more into now, at least with our time here at the National Park Service.
Yeah, and this is one of the reasons why I wanted to bring in Sydney, because we've had so many conversations in between us while working at NPS about minority groups, especially the Latinx, because we both come from Mexican families. I think El Paso, our population is primarily Latinx. Mm-hmm. So, Sydney, what is environmental health? How would you describe to someone that doesn't know anything about environmental health, which is a lot of people in this area? How would you describe what that concept is? And later on, I wanted to ask you, like, why should people care about this? Because it's impacting people that don't know what this is. So tell us a little bit more about what is it in your own terms. It doesn't have to be scientifically.
Yeah, that's okay. Yeah. So to me, environmental health is the resources that the environment provides you in allowing you to live a healthy life. So that could be the air that's not just in your house, but outside of your house based on where you are geographically. You know, you could be next to a refinery and not have a very good, air quality compared to somebody who lives miles and miles and miles away from a refinery, mm-hmm. or a landfill, or, lots of other things that, especially here in Texas, that we have a lot of those things that provide or that really diminish a lot of air quality and environmental health factors like that. Mm-hmm. Other environmental health factors could be like the green space lacking of green spaces, not having access to visual green space, which does a lot for your mental health as well as physical health. If it's a park nearby, there's a lot of communities in Texas or all over the country that don't have parks nearby. Mm-hmm. They have to go miles and miles to find the nearest park, or they don't know what a park is in the way that it would serve them mentally or physically in recreation, or just being able to see green spaces does a lot for your mental health in terms of like relaxing you and making you and it, like there's studies saying that kids that are able to see trees outside of their classrooms get higher grades than kids that have no windows in their schools. Mm-hmm. So there's just a lot that it does to you mentally, having these green spaces. And that's a factor of environmental health as well.
And I was going to ask you. So because I know we've talked about this, like there is also a link of the lack of these spaces in regards to demographics. So it's mm-hmm. typically the people that lack or are not close to these spaces are underrepresented groups. And these groups are the ones that have higher impacts on their health. So they have more problems. So can you tell us a little about the health indicators? What is being measured out to say, oh, this community is unhealthy or not healthy? Like,
yeah,
what kinds of problems do these groups of people have in their health?
Yeah. Well, a lot of it, like even with like COVID is, you're seeing the effects of how certain communities are affected more by COVID than others because of environmental health factors, just having, people that live closer to refineries or areas that are heavily polluted with smog or whatever, are more likely to have asthma. So when you have asthma, that puts you at a greater risk for COVID and for contracting COVID and, possibly dying from COVID. So that's a huge health indicator, when identifying like who is most at risk for getting like this pandemic disease, when looking at just what areas have the least amount of environmental health in their community based on the air quality, the water quality, the access to green spaces, the access to healthy foods, even like grocery store, like deserts. What are they called?
Food deserts.
Yes, food deserts. Right. All of those are health indicators, and those all add up to like adding a lot of COVID cases too, that are you're seeing it now with more people that have asthma, more people that have access that aren't able to eat healthy foods, that aren't drinking healthy water. They're contracting COVID much quicker and dying from COVID much in higher amounts too.
So let me tell you a little personal story. When I lived in San Antonio, my last apartment was a mixed income complex that mm-hmm. was downtown, because living downtown is super expensive. So I remember when I moved to that apartment, getting into the closest grocery store was way more difficult when I lived in another area that was like not mixed income. Mm-hmm. And the quality of the produce and all the things sold at that grocery store was very low and very poor. Like there wasn't an option for organic food. It's like they don't even really like and it's HEB, and I love HEB, but even HEB, what they were putting or offering to this like more like low income area was like less of a quality than in a better area than I lived before. Mm-hmm. So it starts even with that, like businesses, what they're offering to these different populations. The quality of food is not the same because they cannot afford it. Instead of providing like I don't know, community gardens or community farmers market that could improve the health of these people. So it's like super interconnected. But this conversation reminded me of that I was like, why is there no organic food? And then I was like, well, yeah, these people cannot afford it and they give them this crappy food. Like,
Yeah.
it's frustrating.
I wish I had this map in front of me right now to show y'all, but I saw a TikTok of this girl. She was looking at a map of Houston, like, you know, Houston's huge and it's very diverse, right? But we still have, you know, communities that are concentrated into mostly white communities, mostly Hispanic communities, mostly Black communities. And, you know, it labeled them like, this is the white community, and yeah. And then she put like a layer on top showing like where are the Trader Joe's and where are the Whole Foods, and they're only in white communities.
Yeah.
You know, and it's, you know, like it's hard with, like, I mean, this is kind of off the topic, but it's hard with food deserts because, you know, these grocery store companies, you know, food has to be because it perishes so quickly, you know. You have to, like, you take it from the farm, you put it on the truck, you take it out there. It could be, there's a limit to how long it can stay on the truck, you know. And if you're a grocery store, you know, you want to, like, you're not going to make like 50 grocery stores in one city, you know. You're going to condense them closer to each other so you don't have to drive across the city to make your deliveries, you know. So it's harder on the grocery stores to like spread out their product. But when we're talking about people here and getting access to fresh food, everybody deserves the same access to it. So it's a more complex problem than just like, why can't we put a Whole Foods in this Latino community?
And
when the Latino communities,
it's not even like they need a Whole Foods, but everyone should have access to the same good quality food.
Right.
You know, it's this like greenwashing of, oh, this is organic and it costs $2 more and these communities cannot afford it. And so let me give you the crappy food.
Yeah.
And so this is the importance of green spaces and providing more community access so that they at least can have a source of food of their own. I mean, that's just one of the solutions, but
right.
The best solution, but it's education also, like informing. And that's why I invited you here, because it's informing the community like, hey, your lack of like resources and your unhealthy environment is making you sick and you don't know this.
Mm-hmm. Yeah, and it is a lack of information in a lot of cases. Like, there are like nonprofit groups that go out and tell people, you know, like, instead of, you know, buying your food from a convenience store, try and it's not healthy food, it's like chips and candy and stuff. You know, let's develop a community garden in our like nearest green space and make it something that everybody can use together. But that's not available in every community, you know, like those are nonprofits that work on, you know, I know like in North Carolina, there was a group that talked to our class about doing that sort of thing in a lot of rural or a lot of Black communities in North Carolina that were very, very like had no grocery stores, even like just not just like non-organic, just had no grocery stores. So they all were just surviving on convenience store food. And in like terms of like closer communities, like informing people on what is like how to create a community garden, just back to like environmental health, like there's so much that we don't know because of, and like back to like Latino communities too, there's so much that we don't know, and also because there's so many people in Latino communities that don't speak English, and because there's no Spanish translation for a lot of like organizational materials telling you like, hey, let's try and make a community garden. Does anybody know how to grow this vegetable? There's that like disconnect has a lot to do with environmental health issues, is like not having that stuff translate. A lot of people think that like immigrants that come to like the United States, and like a lot of people come alone and don't know anybody that speak English, or themselves don't speak English, and they think that like they'll figure it out, or they know somebody that speaks English that'll tell them these things. But in reality, there's a lot of people that come to this country that don't know any English and have to like get by with the information that they know, which is probably not a lot when they're coming to a new country and just winging it. So a lot of it with the community gardens, it has to do, a lot of it has like with Flint water, they didn't tell their Latino community until for a long time. Like they didn't know that their water was polluted, had lead in it, because they didn't know how to talk to the Latino community or like have a translation in Spanish. So they were like the last people to know.
Oh my gosh, this pisses me off.
So a lot of it is this disconnect with information too, which is a huge indicator for environmental health too, because there's not anybody doing this, like bridging this gap in a lot of situations, at least.
Oh my God. This frustrates me a lot.
Yeah. And also like with like vaccines too. Like I think like Hispanic women are like way more likely to get HPV or cervical cancer, because this disconnect of knowledge that there's a vaccine for it. Because we don't like, as like Latino women don't get vaccinated as much as other groups, and are more likely to get cervical cancer because they're not knowledgeable of the cervical cancer vaccine or the HPV vaccine. And
or even sexual health.
Yeah, exactly. And a lot of that has to do with the disconnect of translating things or making that knowledge accessible to everybody.
I think that also has to do with the, I guess, conservative mentality of Latino women, where, you know, you don't go get checked and you don't,
it's true.
you know, that was a thing of, because I remember when I was younger and I'd ask my mom, like, hey, shouldn't I go to the doctor? And she'd be like, oh, no, like, you don't go to that doctor.
Yeah.
The gynecologist is a taboo subject, you know? So
yeah.
I think that's also a problem of why there's, you know, high rates of
or even just the conversation itself, like it's like we do not talk about that in this house, like it's completely outside of the subject.
No, actually the first time I went to the doctor, it was by myself. Like it was like, I think I need to go and check things out. It's like my body.
Yeah, exactly.
I've done it, and I did it at a very late age. Like I think with when you get your period, not
younger. Yeah, see, that was a conversation when I had my kids. I asked their pediatrician, like, when should I be taking them and when should they start going, because of the previous mentality of not going to a gynecologist and not getting yourself checked. And, you know, so I took my daughters when they were younger, and, you know, yay, right? So we got to change the narrative on that, where it's not a bad thing and it's better to be cautious. So
get rid of those taboos.
Exactly.
And now that I think about it, it's not even that. It's also like if you like were outside and had a cut. No le pasa nada, mijita. Everything is fine.
Let me just put this on there.
Yeah, you're gonna be okay, and you're bleeding to death.
Yeah. There's so many reasons like why like we never wanted to go to the doctor, you know, and it wasn't like not just like because we couldn't afford it or we didn't have insurance, or, you know, it's just like the stigma that the culture gives you too. Like you don't need to go to the doctor, you know, you're fine, you know?
Yeah. I grew up being scared of the doctor, and the other doctor, the gynecologist, is that how you say it?
Gynecologist.
I only
say it in Spanish. I mean, that's something that a lot of my friends, when I went, I was like, hey, dude, you have to go. And I started taking all my friends one by one.
Good. Yay, good for you.
Afraid,
yeah, I still
or I mean, they had their own reasons, but I was like, I did it. There's nothing wrong of going. Just like stop that. It's better to prevent any kind of thing than to like being afraid or ashamed of something that you shouldn't be afraid of.
You shouldn't be.
No.
Yeah. Like going to the dentist.
But it all boils down to environmental health and that lack of communication and that mentality. And I think it's very strong in Latinx women, like more than any other. I don't know. I mean, who knows? But we all are Latinx women, and we know what that is. And growing up wasn't as easy.
Mm-hmm.
And it's not that the resources are not there.
Right.
It's a lack of communication. So Sydney, you were also gonna tell us a little bit more about your mapping exercises.
Yeah. So when I'm not a community planner with the National Park Service, my side gig is, it's a volunteer opportunity. So I volunteer with an organization called Public Health Maps. And we are a small nonprofit that basically works to provide information based on geographical data on public health issues. So we have like a map of the week based on different current events in the world. There, you know how there's like National Diabetes Day or National High Blood Pressure Day or National Sleep Day. We have like a calendar of all of those days throughout the year. And every week we try and provide like a map representing that kind of stuff. Or a topic related to it. And so we kind of just put like a geographical aspect to all of the public health problems going out there. So so what my job is, I'm the I am the environmental health lead. So the mapping that I do, or the kinds of maps that I'm interested in, are regarding the environmental health factors like I talked about with air quality and water quality and green spaces, and how, especially when you look at those things geographically, you notice how they disproportionately affect different communities. So, and that's something that I'm really passionate about, is how these environmental factors affect especially Latinx communities disproportionately, and what kind of measures you can take to bridge that gap.
Do you have by any chance an example?
Of a map of that?
Yeah. No? Is there something online?
What?
If not, is there like one online? Or if not, what you can do is send us like an image, and when we post your conversation, we can put it there so that people can see it.
Yeah. So there's a organization called Salud America. They're based out of San Antonio. Have you ever heard of them, Maria?
Yeah.
So they do a lot of work with like health factors with Latino communities. And we do like, they have like a tweet chat on Tuesdays where they ask questions about based around like public health factors like smoking and COVID and diabetes, and like how they disproportionately affect Latino communities. So they're a really good resource for looking at a lot of that stuff. You could also go to publichealthmaps.com and see a lot of the maps that we create maps, but we also pull them in from different organizations like the CDC. Johns Hopkins has a really good COVID map right now where they're basically updating the COVID cases every day. And we kind of have like our website is basically a list of those resources and where you can find public health data, and we show them to you with maps.
Okay, we're gonna check it out.
Okay, I'll do some research and look for you too.
Yeah. Well, does anyone have any questions for Sydney?
I mean, she has been explaining everything pretty well. Like, I think, yeah, there's that disconnection in everything. It's different factors, just not the communication, the taboos and everything. Have you seen anyone like putting a plan of action to maybe like create a group or just like literally making a strategic plan on how to find different like ways of getting rid of those, like just like the communication, for example? Because I mean, they could just have someone that it literally translates everything and being able to pretty much communicate that to those communities. Do you see that anything has been happening in that respect, or do you think it might happen? Is it in the talks? Like, what are you seeing in that respect?
Yeah, I think it's really trendy right now to be working with like minority communities. We're doing it with the National Park Service. And like those organizations that I named, like Salud America, their whole thing is providing Latino communities in San Antonio with this information regarding their public health. So, and that's great, but that's like one city, when we have communities of smaller cities or smaller towns that they have this exact same problems, but not the resource. So yeah, I think it's trendy and it's up and coming, like concern of a lot of people, but it's slow moving. And this work helps because it takes the word out there, like what we're doing with the National Park Service. We're trying to meet those smaller communities, and with like Salud America, that group, they're based in San Antonio, but they're providing these resources in Spanish that are beneficial for any public health concern. So it's I think
translating everything.
Yeah, I know. Yeah, I think I didn't realize that until I found that out. Sorry, go ahead.
Sorry, it's not just in one language; it's in several.
Yeah.
Because
So in El Paso, what environmental health concerns have you identified, if any, or has that work even been done?
Yeah, I can answer that because I did a community health profile, which has all these things that Sydney talked about, and it's like it gives you like all the demographics, all the health issues, all the food deserts, all the what else was it? Mapping of different things like farmers markets around the city. And El Paso is really high in asthma and cardiovascular problems and diabetes and cancer. We're kind of high on that. I can pull out that information and data because I have those things, but it also, like, we don't have adequate access to good food. Our air quality is not good. We have the refinery, and we have a lot of recyclers, and we have a lot of industrial sites in Juarez, but we're also, like, it's not only Juarez, El Paso does a lot of like pollution as well. We have a lot of underrepresented, like, poverty level families and low income families living next to the refineries and living next to where all these landfills and polluting sites are. And they're just getting sick. And the problem is that they don't have like good health care. So it's sad. And we should think about what we can do as a community to start raising awareness on this and communicating better with our community about it. Because many of them don't know that they're sick because of this.
Because of all of the pollution that's going on.
Yeah.
Is there a plan of action for that, or in El Paso particularly, or?
I don't think, we don't even have a climate action plan, so I don't think that there is a plan, but we should look into it.
That's what we want to do.
Yeah. We want a climate action plan.
Yeah, and like to take it like a step back, it's when you think about like environmental health and like indicators of like, you know, is it because I'm Latino that I'm getting all these, like that I have high blood pressure? Is it because I'm a woman that I have, you know, this other thing? And that's another, like on top of all of it, you have to question like, it's not your like who you are that's giving you these health concerns. It's the environment around you that is providing it to you. You know, like, well, like, you know, Black women are more likely to have high blood pressure than anybody else. You know, that's true based on the numbers, but it's also could be because of the environmental factors that primarily affect that group of people. You know what I mean? So like when you think about health and public health issues, a lot of it has to do with the environmental health factors that have made that stigma or that stereotype of that health concern.
Yeah, and of course also like the mind. Like if you're stressed, you're more prone to get sick. But also if you live in a stressful environment,
mm-hmm.
it's just gonna make it worse.
Yeah.
Well, I don't know if anyone has any more questions for Sydney, but we want to thank you. We honor your time and the space you've created for us, and we learned a lot tonight about this important topic. And from now on, say goodbye to the stigmas. Our health goes first, and it should be the first thing we really care about. So thank you so much for bringing up this conversation.
Yeah, no problem. I hope that, you know, I hope y'all, everybody that watched this learned something, but I hope El Paso and, you know, every community, you know, understands more about the environmental health issues that are affecting their people.
Mm-hmm. Yeah. Well, Sydney, thank you so much. We really do appreciate your time. Thanks. There's a couple of things I definitely did not know. And we're going to go ahead and look at those sites. The public health maps seems very interesting, so it's definitely something that I'm going to check out. And hopefully we get someone like you in El Paso that can do that as well. Just because, again, I believe there's a big need here and there's a lot of miscommunication and not enough education. So thank you so much for bringing that up, and hopefully that opens the eye to other people.
Yeah.
Thank you so much. It was nice talking to you. Super informative.
All right.
Thanks for having me, guys.
Thank you.
Thank you, Sydney.
Nice to meet y'all.
Bye.